Many people associate serious illnesses with symptoms that are obvious and immediate. Chest pain is often linked with heart disease. Severe headaches might prompt concerns about neurological conditions. In daily life, people tend to expect that when something serious develops inside the body, the warning signs will be unmistakable. However, some medical conditions do not follow that pattern. Certain diseases develop quietly, producing subtle physical changes that may not appear alarming at first. In many cases, these changes are easily mistaken for common digestive discomfort, fatigue, or temporary illness. Because of this, individuals may continue their normal routines without realizing that their body is signaling something that deserves medical attention. Pancreatic cancer is frequently discussed in this context within medical research. Healthcare professionals often describe it as a condition that can progress for some time before clear symptoms lead to evaluation. The pancreas itself is located deep within the abdomen and plays a critical role in digestion and hormone regulation, including the production of insulin and digestive enzymes. When this organ is affected by disease, the changes can influence multiple systems in the body, from digestion to metabolism. Understanding how early physical signals may appear is an area of ongoing medical study. Researchers and clinicians continue to investigate which patterns of symptoms might prompt earlier medical evaluation and potentially improve detection. In this discussion, we will examine what current medical literature says about symptoms that have been associated with pancreatic cancer and how these observations are interpreted in clinical practice. Public understanding of pancreatic cancer is often shaped by partial information or by experiences shared in media and personal stories. One common perception is that serious cancers always produce dramatic symptoms early in their development. This assumption can lead people to believe that if they feel generally well, a serious underlying condition is unlikely. In reality, many medical conditions, including pancreatic cancer, may begin with symptoms that resemble more common and less serious health issues. Mild digestive discomfort, fatigue, or temporary appetite changes are experiences that many people encounter during everyday life. Because these symptoms are so common, they are frequently attributed to diet, stress, or routine digestive disturbances rather than prompting medical evaluation. Another source of confusion comes from how symptoms are discussed in popular health content. Lists of warning signs can sometimes appear to suggest that experiencing any one of these symptoms indicates a high likelihood of disease. In clinical practice, however, physicians rarely interpret symptoms in isolation. Instead, they evaluate patterns, persistence over time, medical history, and diagnostic testing. Medical professionals also emphasize that pancreatic cancer is considered relatively uncommon compared with many other health conditions that produce similar symptoms. According to the National Cancer Institute, NCI, pancreatic cancer represents a small percentage of all new cancer diagnoses each year in the United States. As a result, symptoms such as abdominal discomfort, bloating, or fatigue are statistically far more likely to be related to other causes. Confusion can also arise because symptoms may vary depending on where a tumor develops within the pancreas. Tumors located near the bile duct may cause different physical changes than those that develop deeper in the body or tail of the pancreas. For these reasons, healthcare providers focus not only on the presence of symptoms, but also on their duration, progression, and relationship to other clinical findings. Understanding this broader context helps explain why early detection can be complex and why careful evaluation is important when symptoms persist or change over time. Scientific understanding of pancreatic cancer has developed through decades of clinical research, population studies, and epidemiological monitoring conducted by major health organizations. While the disease remains challenging to detect in its early stages, a large body of medical literature provides insight into how frequently it occurs, how it is typically diagnosed, and what patterns researchers have observed. According to the World Health Organization, WHO, and the International Agency for Research on Cancer, IARC, pancreatic cancer is among the leading causes of cancer-related mortality worldwide. Its overall incidence is lower than that of several other cancers, but mortality rates remain relatively high because the disease is often diagnosed at later stages when treatment options become more limited. Data published by the National Cancer Institute, NCI, and the Centers for Disease Control and Prevention, CDC, show that pancreatic cancer accounts for a modest proportion of total cancer diagnoses in the United States, but it contributes disproportionately to cancer deaths. Researchers attribute this pattern largely to the difficulty of identifying tumors early, rather than to unusually high rates of occurrence. Clinical studies also indicate that early symptoms are frequently nonspecific. A large observational analysis published in peer-reviewed medical journals has shown that many individuals who are later diagnosed with pancreatic cancer initially report symptoms that overlap with common gastrointestinal conditions. These may include abdominal discomfort, changes in appetite, fatigue, or digestive irregularities. Importantly, the presence of these symptoms alone does not confirm the presence of pancreatic cancer. In clinical practice, physicians interpret such symptoms within a broader diagnostic framework that includes medical history, laboratory testing, and imaging studies such as CT scans, MRI scans, or endoscopic ultrasound. Researchers are also studying patterns of symptom combinations. Some academic medical centers have explored whether certain clusters of symptoms may prompt earlier clinical evaluation. For example, research programs at institutions such as Johns Hopkins Medicine have examined how symptom patterns combined with imaging or biomarker testing might contribute to earlier identification. These findings are considered exploratory and are part of ongoing efforts to improve detection strategies. Screening for pancreatic cancer in the general population is not currently recommended by most public health authorities because evidence has not yet shown that routine screening improves outcomes for people without elevated risk factors. However, several medical organizations recommend targeted monitoring for individuals with strong family history or specific genetic predispositions. Overall, the scientific literature emphasizes that pancreatic cancer research remains an active field. Ongoing clinical trials, epidemiological studies, and advances in imaging technology continue to expand the medical community's understanding of how the disease develops and how earlier identification might eventually be improved. To understand why pancreatic cancer can influence multiple symptoms throughout the body, it helps to first understand the biological role of the pancreas itself. The pancreas is a glandular organ located deep in the upper abdomen, positioned behind the stomach and surrounded by several critical structures, including the small intestine, bile duct, and major blood vessels. Physiologically, the pancreas performs two major functions. The first is exocrine activity, which involves producing digestive enzymes that help break down fats, proteins, and carbohydrates in food. These enzymes travel through small ducts and eventually enter the small intestine, where digestion continues. The second is endocrine activity, which involves releasing hormones such as insulin and glucagon into the bloodstream to regulate blood glucose levels. Most pancreatic cancers originate in the exocrine portion of the pancreas, particularly in cells lining the pancreatic ducts. This type of cancer is commonly referred to as pancreatic ductal adenocarcinoma, which accounts for the majority of diagnosed cases according to clinical research published in journals such as The Lancet and the New England Journal of Medicine. At the cellular level, pancreatic cancer develops through a gradual accumulation of genetic mutations that affect how cells regulate growth and division. Healthy cells follow strict biological controls that signal when to divide, repair damage, or undergo programmed cell death. When key regulatory genes are altered, such as tumor suppressor genes or growth signaling pathways, cells may begin to grow uncontrollably. These abnormal cells can gradually form a tumor within the pancreas. As the tumor expands, it may begin to affect nearby structures because of the pancreas's close anatomical relationships with other organs. One important structure located near the pancreas is the common bile duct, which carries bile from the liver and gallbladder into the small intestine. Bile is essential for digesting fats and for removing waste products, such as bilirubin, from the body. If a tumor develops near this duct, particularly in the head of the pancreas, it can partially obstruct bile flow. When bile flow becomes restricted, bilirubin may accumulate in the bloodstream. Clinically, this process can contribute to jaundice, which is characterized by yellowing of the skin or eyes and changes in urine or stool color. These changes are not unique to pancreatic cancer and can occur in many liver or bile duct conditions, but they illustrate how the pancreas interacts with broader digestive and metabolic systems. Tumor growth can also affect the pancreas's ability to produce digestive enzymes. If enzyme production becomes impaired, or if pancreatic ducts become blocked, the digestion of fats may become less efficient. This can lead to changes in nutrient absorption and alterations in stool characteristics. Another physiological mechanism involves the inflammatory response triggered by tumor development. Cancer cells can release signaling molecules that influence immune system activity and inflammatory pathways. In some individuals, these signals may contribute to systemic effects such as fatigue or changes in metabolism. Additionally, pancreatic tumors can influence the surrounding nerve networks located in the upper abdomen. The pancreas is closely associated with a complex bundle of nerves called the celiac plexus, which helps transmit pain signals from abdominal organs. When tumor growth interacts with these nerves, it can produce discomfort that radiates from the abdomen toward the back. Researchers also study how pancreatic tumors interact with the body's coagulation system, which regulates blood clotting. Some cancers are associated with increased clotting activity due to inflammatory signaling molecules released by tumor cells. This biological interaction between cancer and the circulatory system has been documented in clinical literature and continues to be investigated. These interconnected mechanisms illustrate why pancreatic disease can affect multiple physiological systems simultaneously. The pancreas participates in digestion, metabolism, hormonal balance, and interactions with surrounding organs. As a result, changes in pancreatic function can sometimes produce symptoms that appear to originate from several different parts of the body. Understanding these biological relationships helps clinicians interpret symptoms in a broader physiological context and guides researchers as they explore new diagnostic and treatment strategies. The long-term health impact of pancreatic cancer is influenced by several factors, including the stage of diagnosis, the biological characteristics of the tumor, and the overall health of the individual. Because the pancreas participates in both digestion and metabolic regulation, disruptions to its function can affect multiple systems over time. One of the most significant considerations is how pancreatic cancer may influence nutritional status and metabolic balance. The pancreas produces digestive enzymes that allow the body to absorb essential nutrients from food. When pancreatic function becomes impaired, the body may have difficulty processing fats and certain nutrients efficiently. Over time, this can contribute to unintended weight loss or reduced nutritional absorption. In clinical practice, healthcare providers often monitor nutritional markers closely in patients with pancreatic conditions. Another potential long-term effect involves glucose regulation. The pancreas contains specialized endocrine cells responsible for producing insulin, a hormone that helps regulate blood sugar levels. When pancreatic tissue is affected by disease, these regulatory processes may be disrupted. Research published by institutions such as the National Institutes of Health, NIH, has documented associations between pancreatic disease and alterations in glucose metabolism, which may contribute to the development of diabetes in some patients. From a broader health perspective, pancreatic cancer can also affect functional capacity and quality of life. Individuals undergoing treatment may experience changes in energy levels, digestion, and physical endurance. Medical teams therefore often focus not only on treating the disease itself, but also on supporting physical function, nutrition, and symptom management. It is important to note that outcomes can vary widely. Advances in surgical techniques, targeted therapies, and supportive care have gradually improved treatment strategies in recent decades. While pancreatic cancer remains a serious condition, ongoing clinical research continues to explore earlier detection methods, improved therapies, and multidisciplinary care approaches. Medical literature increasingly emphasizes the distinction between lifespan and health span, the number of years lived versus the quality and functionality of those years. For individuals with pancreatic disease, maintaining nutritional balance, managing symptoms, and preserving daily functioning are central components of comprehensive care. For these reasons, clinicians approach pancreatic cancer not only as a localized disease, but as a condition that may influence the body's broader physiological systems over time. Within modern medicine, recommendations about pancreatic cancer are guided by evidence collected from clinical studies, population health data, and expert review panels. Several international and national health organizations regularly evaluate this evidence to develop clinical practice guidelines. Organizations such as the World Health Organization, WHO, the National Institutes of Health, NIH, the American Cancer Society, ACS, and the U.S. Preventive Services Task Force, USPSTF, generally agree on several key points regarding pancreatic cancer. First, most medical authorities do not recommend routine screening for pancreatic cancer in the general population. According to guidance from the USPSTF and other public health organizations, current screening methods have not yet demonstrated clear benefits for individuals without known risk factors. Because pancreatic cancer is relatively uncommon compared with many other diseases that cause similar symptoms, large-scale screening of healthy individuals could lead to unnecessary testing or medical procedures. However, many experts agree that targeted monitoring may be appropriate for people with elevated risk. These higher risk groups can include individuals with certain inherited genetic mutations, strong family histories of pancreatic cancer, or specific hereditary syndromes associated with increased cancer risk. Clinical guidelines published by gastroenterology and oncology associations often recommend specialized evaluation or surveillance programs for these populations. Medical consensus also supports multidisciplinary care as the standard approach for managing pancreatic cancer. This typically involves collaboration among oncologists, gastroenterologists, surgeons, radiologists, and nutrition specialists. Such coordinated care allows physicians to evaluate treatment options from multiple perspectives and tailor strategies to the individual patient's clinical situation. At the same time, researchers acknowledge that several aspects of pancreatic cancer remain areas of active scientific investigation. Ongoing clinical trials are exploring improved imaging technologies, biomarker testing, and new therapeutic strategies. As these studies progress, recommendations may continue to evolve. In summary, expert consensus currently emphasizes careful evaluation of symptoms, targeted monitoring for higher-risk populations, and continued research aimed at improving early detection and treatment outcomes. From a public health perspective, the most responsible approach to pancreatic health focuses on awareness, routine medical care, and informed discussions with healthcare professionals rather than self-diagnosis. Health authorities generally encourage individuals to pay attention to persistent or unexplained physical changes, particularly those involving digestion, appetite, weight, or abdominal discomfort. These symptoms are common and often caused by non-serious conditions. But if they continue for an extended period or change in pattern, healthcare providers typically recommend medical evaluation to determine the underlying cause. Maintaining regular contact with a primary healthcare provider also plays an important role in preventive health. Routine medical visits allow clinicians to review family history, evaluate risk factors, and determine whether additional evaluation may be appropriate. For individuals with a known family history of pancreatic cancer or hereditary cancer syndromes, physicians may discuss whether referral to specialized genetic counseling or high-risk monitoring programs is warranted. Public health organizations also emphasize broader lifestyle practices that support overall metabolic and digestive health. Evidence from epidemiological research suggests that maintaining a balanced diet, engaging in regular physical activity, avoiding tobacco use, and managing body weight may contribute to reducing the risk of several chronic diseases, including certain cancers. These recommendations are part of general preventive health guidance and are not specific treatments for pancreatic disease. For viewers seeking more information, healthcare professionals often suggest discussing questions such as whether any persistent digestive symptoms should be medically evaluated, whether personal or family medical history indicates elevated cancer risk, whether screening or monitoring programs may be appropriate. Open conversations with qualified healthcare providers remain the most reliable way to interpret symptoms and determine appropriate next steps in individual health situations. Understanding complex health conditions often begins with asking better questions about how the body functions and how medical research interprets symptoms. Pancreatic cancer is a condition that continues to receive significant attention from scientists and clinicians because early detection remains challenging. Current medical knowledge shows that many of the symptoms sometimes associated with pancreatic cancer, such as digestive changes, fatigue, or abdominal discomfort, are also commonly linked to far less serious health conditions. For this reason, healthcare professionals rely on a careful combination of symptom evaluation, medical history, diagnostic testing, and imaging when assessing potential concerns. Ongoing research conducted by institutions around the world continues to explore improved diagnostic tools, including advanced imaging technologies and biological markers that may one day help identify pancreatic disease earlier. For individuals, the most practical takeaway is not to assume the worst when experiencing common symptoms, but rather to remain attentive to persistent changes in health and to seek professional guidance when concerns arise. Health knowledge is most valuable when it empowers people to make thoughtful decisions, maintain regular medical care, and stay informed as scientific understanding continues to evolve. The information presented in this content is intended for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment. Health conditions and symptoms can vary significantly between individuals, and only a qualified healthcare professional can evaluate specific medical concerns. If you are experiencing persistent symptoms or changes in your health, consult a licensed physician or other qualified healthcare provider for appropriate medical evaluation and guidance. Do not disregard professional medical advice or delay seeking care because of information presented in this content. Always consult healthcare professionals regarding questions about medical conditions, diagnostic procedures, or treatment options. This material is not a substitute for individualized medical consultation.